Okay, we're back and we are going to go for shoulder girdle now. So the first one on your list is serratus anterior. So this is going to be done gravity minimized because we're still seated position. And I'm going to support fully her arm. So when you're supporting an arm, make sure that you're supporting, if you could see, my arm is stretched out so that I can support her humerus and her forearm as well. And I'm going to palpate serratus because this is a gravity minimized position. So I'm on her, just beneath her scapula and the midline by her thorax and her ribs. And I'm going to have her basically tell her to punch forward. So it's protraction. And so I'm going to support while she does that. And she does it just fine. So she's a 2 out of 5 muscle grade. Okay. So the next thing to do now is to give minimal resistance throughout the range. So now I'm going to move my support and I'm going to ask her to make a fist. And now I'm going to make sure that your patient isn't protracted already. So we're just going to position her a little bit back further. Okay. And then so I'm supporting her and I'm giving resistance through her hand, through her fist, and I'm going to tell her to punch through my resistance. So minimal resistance throughout the range. Good. And now she's a 2+. Okay, so we just did a 2, and we did a 2+. And the against gravity position is going to be supine when we get on the table, punching up towards the ceiling. All right, the next one on your list is upper trapezius and levator scapula. We can do seated position for against gravity, and it's bilateral that we usually test. It's just easier than somebody elevating their shoulders. So we're doing shoulder elevation. So now she's going to, I'm going to ask her to shrug her shoulders up for a 3. So Shannon, can you just shrug your shoulders up? Perfect. Okay. So now I'm going to give her a break test because this is against gravity. So she just shrugged her shoulders, elevated her shoulder blades. And remember, shoulder girdle involves the scapula, so you're always looking for scapular motion. Okay. So now I'm going to kind of hover just an inch or so above, and I'm going to not be on the acromion, but more on the spine of the scapula with the palm of my hand. So when she comes up, meet my hand, don't let me push you down, Shannon. Hold it, hold it, hold it. We're doing a break test for against gravity. Perfect. Okay, so she's a 5 out of 5 there for sure. So again, bilateral because you don't want anybody to torque their neck or, you know, when you elevate one side, it's very uncomfortable and sometimes patients can't do it and hold position for the break test. Okay, so this next one is your middle trapezius. So your middle trapezius kind of looks like the posterior deltoid, except you're looking for the retraction. So you're looking for the scapular squeeze. And you can tell the patient to do it bilaterally so you get the actual motion, the desired motion that you want. So actually, I'm going to have Shannon turn around so you can see her back. Okay, yeah. Actually, you can sit like as you face this way and put the ass in this way. There's no chair in the way. So I'll just, it's easier for her to, for you guys to see. So if I want her scapulas to retract, so I'm going to say squeeze your shoulder blades. So that's what shoulder retraction looks like. Looking at the shoulder blades squeezing together towards the spine. Okay. So now if we're doing middle trapezius, it's going to be in a gravity minimized position. So prone is against gravity. So I'm going to support her shoulder. I'll just do the left side since I'm already here. And I'm going to bring out her shoulder to 90. So I'm supporting her fully. And it looks like posterior delt. I'm going to start her a little bit forward to give her some room, some space. But I'm going to palpate in here at her retractor. Okay. So as she does that motion, I'm palpating, and she's a 2. She did it. That's fine. Now, if I want to add resistance for a 2+, I'm going posterior humerus, distal, and we're squeezing. Okay. And she's dropping just a bit. I'm going to bring her up, and that's my fault, so I can support her a little bit better. Okay, do that one more time for 2+. Trying to stay out of the camera's way as well. Okay, thank you. All right, so that was 2 and 2+ for your middle trapezius. Okay, so the next one is rhomboids. So rhomboids, I'm going to have you do this side. So I'm going to ask you to put your arm back, just like so. So rhomboids, the action is a lift away from the spine. And basically, we're keeping that shoulder relaxed. We know it's downward rotation and retraction that we're trying to achieve here. So, I'm going to talk to the camera at the same time and be out of the way. So I'm going to support her forearm. So you can see my arm supporting her forearm, and I'm going to palpate here, and I'm going to ask her to lift her arm away from her back. And I feel the muscle working, and I see the scapula moving. Good. Good. All right, so right now she's a 2. Okay? So now I'm going to move to my resistance. So I'm still supporting, but I'm going to push a posterior humerus down and out that way into an opposite force of the retraction and the downward rotation. So I'm going to ask you to do that one more time. I'm supporting, but I'm giving resistance. Good. And now she's a 2+. Okay, great. Thank you, Jen. All right. I think that is all for the sitting. So we're going to have to stop here and get back with our on the table ones. Okay.